the beauty of Ayurveda is that, PCOS can be reversed. I know in Western medicine, there is no full cure to PCOS, but in Ayurveda, PCOS is seen differently. It's not one disease, it's a combination of many things.
Welcome back to my channel. I'm Dr. Ami Patel, pharmacist and fellow sister. And today I'm really excited to have a special guest speaker with me, Dr. Chinki Bhatia. She is also a pharmacist, and so I'm really excited to have her. Thank you for doing this conversation with me, Chinki.
Thank you, Ami. It's a pleasure being here. I always see your work. I've seen your past podcasts or interviews, and they've just been so great, so informative. Thank you for your work.
Oh, thank you. Thank you. So I will give a little bit of introduction into who Chinki is, and then we'll talk about her PCOS journey as well as Ayurvedic medicine and how that could be helpful to PCOS. So Dr. Chinki Bhatia got interested in medicine early on from her grandmother, who was an Ayurvedic practitioner. She then went to India to study pharmacy and then immigrated to Australia to get a master's in pharmacy at the University of Sydney with a specialization in vitro fertilization. And then she received a scholarship from the University of Florida to complete her PhD in neuroscience in 2004. And while working on her PhD, she also worked on multiple projects, such as studying the role of cannabinoids in short-term memory. And she was also serving as a role model and mentor to other students at the time. And since then, she now works as an independent pharmacist and Ayurvedic coach. She helps her patients with hormonal and pelvic health concerns, and she likes to integrate the best of both worlds to get optimal outcomes. She takes a personalized approach to medicine and recently got a pharmacogenomics certification in 2020. And earlier this year in 2021, she co-founded her company, Core Care RX, where she provides nutrigenomic consultations and value-based care to look at chronic care management of conditions. And she also is a preceptor to students in pharmacogenomics. And in addition to all her professional activities that she's busy with, she's also a mother to a 7-year-old daughter, and she loves to cook and hike and enjoys outdoor activities. So thank you again for being here, taking time out from your busy professional schedule to do this.
Of course, Ami, thank you so much for the lovely introduction. I can't believe I studied that much. If I have to do it again, I don't know if I would.
Yes, you're very, very hardworking and smart individual.
Thank you. So are you.
Thank you. So why don't you start off and tell us a little bit about when and how you were diagnosed with your PCOS?
Sure. So in 2004, I believe I came to the US. That's when I got my offer for the grad school. And I remember the first year being really very hard, adjusting to a new place, very tough coursework. I was going through irregular periods and I wasn't sure why that was happening. A part of me thought that, I'm just not exercising enough because I've always been exercising, through my childhood. But then when I did go to a doctor and see a doctor, that's when I was diagnosed with PCOS. So that was pretty much like my first year, towards the end of my first year in the US. And based on the conventional medicine, of course, I was put on a birth control pill. But at that point, I don't think the whole concept of lifestyle change was recommended by our physicians and nurses. It's only fairly more recent because maybe the numbers of PCOS have gone. I believe they are like 1 in 10 globally. So the doctors now do emphasize on lifestyle recommendations, but back then it wasn't a thing. So yeah, I just started with the birth control pills.
Yeah, I think that, and like there's just not enough research on like what can be really helpful for every patient. So I think it's can be maybe easier to be like, hey, here's a prescription for something and
True.
I'll see you in like a year. So it's like maybe a little bit of both.
There's no individualized treatment yet.
Yeah. And I think I mean, I'm surprised you got diagnosed with like seeing one doctor, so that's actually pretty good.
No, actually, I didn't. I saw
Oh.
two, three. Because I was on campus, you generally see a nurse practitioner.
Right.
So the first, but she was an experienced nurse practitioner. She knew what was going on because I also, went through the symptoms, and the symptoms were evident enough. But then I took a trip back home. I think it was a Christmas vacation. I grew up in Bahrain in the Middle East. So that's where I saw my physician, my sort of like a family physician, and I got diagnosed.
Oh,
and
wow.
I was put on another birth control pill, but the idea was the same.
Right. Yeah, that's pretty common. Like it takes about a couple providers to get the PCOS diagnosis.
Yes.
So what, other than, I know you mentioned irregular period, but were there any other symptoms that you struggled with the most?
Absolutely, yeah. I think to begin with, my skin takes a toll pretty bad. So acne, hirsutism, even though now I know that I'm getting a regular menstrual cycle, but now and then when my diet is off and I'm not doing what I'm supposed to do, I still see those symptoms. Stress was a big one. Again, stress could be a factor or stress could be a result. So either way, I was very stressed, and a weight gain, no matter how many hours I'd put in the gym, how many diets I would go on, whatever was new, I would try it. And I think I still pretty much never lost enough weight. And I think, with a combined set of symptoms, it does make you anxious and depressed, along with the coursework and the grad school work that you're going through. So pretty much all those.
Yeah, I think, it's with PCOS, it's like a bad cycle, and it's like really hard to get out of the cycle. But it, like you said, all of those symptoms leads to other things like, feeling depressed, and then it's really
it's a
challenging.
vicious circle. It's just a vicious circle, and it's hard to get out of it unless you actually make changes and take responsibility.
So I know you mentioned you tried like all the new diets or anything that came out. When did you, or were there any other challenges you faced in managing PCOS, or like when did you finally feel like something was working?
I'd say it was the weight gain, because I was putting many hours in the gym, and there was another one, hair loss. That really did it for me. I've always, been known to have very thick hair, and so I saw a drastic loss in my hair every time I would shower, which could make me really anxious. And not just my hair, but my eyebrows. I even started losing hair from my eyebrows, from the midsection, which is another classic symptom of PCOS. So that's when I knew that I need to do something about it. By that time, I was married, and I was also trying to, planning for having a baby. But then again, my cycles were irregular. So I think a combination of everything made me really think about, going back to my roots, which is Ayurveda, because again, my grandmother, like you mentioned, who was an Ayurvedic practitioner, I always knew from her that if you want to treat something, don't treat the symptoms, treat the root cause. And that's what led me to go back and take things in my hands and make the right change that I needed to do.
Oh, wonderful. So I know you're basically mentioning how like Western medicine didn't really recommend lifestyle changes to you initially, and you tried birth control, but you were still experiencing, some of the other things. I guess not getting too much symptom relief as you would have hoped for. So how long, and like after you started implementing, an Ayurvedic lifestyle, did you start seeing symptom relief?
Right. So Ayurveda is not a quick pill. You're not just going to,
Yeah.
pop it and you're not going to ovulate like in the next 15 days or something. Um, so the in the Western medicine, when I continued, I kept reading about, losing weight and things will be fine. But I just want to clear this on Instagram that that's really not the treatment. Weight loss by itself is not the only treatment for PCOS. I knew that Ayurveda is something that takes time because in Ayurveda, you need to first identify the root cause. To know the root cause, you need to know what exactly is, what exactly in your dincharya or your daily routine are you not doing right. So to go back a little to the basics of Ayurveda, the PCOS is actually an imbalance between the Kapha dosha and the Vata dosha. Doshas are nothing but like body constitutions. So
Hmm.
Kapha is like a mucus-like substance, which is stationary in your body, and it helps basically in protection and immunity. It lubricates your joints. It creates the structure of your muscle and your bone. And Vata is air, it's wind in your body and plays a role in movement. So it induces your period. When you have an imbalance in these two doshas, it actually leads to PCOS. But what is it that causes the imbalance? So to find the imbalance, that was my actual test. Like I needed to know that what is causing the imbalance in these two doshas in my body. So there are several factors, some of them which you often mention in your videos, like junk food, processed food, stress, peer pressure, which leads to emotional stress. It's not always just physical, it's also mental, and mental plays a big role. Um, and then I think the circadian rhythm, you need to
Mm-hmm.
sleep properly. So when you have an imbalance in any of these factors or all the factors in combination, it causes indigestion in your body, which is bad agni. Agni is indigestion in Ayurveda, and the root cause of pretty much any disease in Ayurveda is agni. It's your digestion. So when
Mm-hmm.
your digestion is bad, your hormones are not going to be produced
Mm-hmm.
at the rate at which they need to be produced, and then it's going to just go downhill, following the cascade, which leads to insulin resistance, metabolic syndrome, and then the symptoms, and then PCOS. So I had to backtrack and see what is
Oh,
it that
wow.
I am not doing proper.
Right.
Um, and I did that along with the help of a very, very, very noble Ayurvedic practitioner. He saw my pulse, and then we went through this whole route of figuring out what is it that I eat. And that's another factor I'd like to address. The whole diet plan in Ayurveda is you eat according to your body's constitution.
Mm-hmm.
So knowing my constitution, I had to pick the items and eat in a balanced way, not, do keto, not do Atkins, not do Weight Watchers, but
Right.
eat in a balanced way along with my body's constitution. And when I did that and I corrected my dincharya, which is my daily routine, I started seeing a difference within 3 months, to answer your question.
Wow. That's really interesting for sure. And yeah, I think 3 months is like, at least it takes that long because, like you said, it's been like years and years of certain habits that you had or certain lifestyle or foods that you were taking in, right? Like through school. It's like years and years you were living a certain way. And to change all that, it's definitely going to take, a few months to see a difference.
Because I know that in grad school, I ended up abusing my body with,
Oh, yeah,
packaged foods, the processed foods. Yeah, I was
for
exercising, but
sure.
there was a point when I was drinking soda to stay awake and lots
Oh,
of caffeine.
yeah.
So
Yeah, I was having like 3 cups of coffee per day, which is like ridiculous in retrospect. But at the time, you're just like only focused on, okay, doing well in school, and then
Yeah.
whatever it takes, and in school, convenience of eating out or eating junk food, processed foods. And yeah,
Absolutely.
I don't think in our 20s we really get, or in our teens, we don't really prioritize our lifestyle. And then I feel like, unfortunately, like you see the results of those bad habits, and then you get something like PCOS, or those symptoms become more evident, and then you're trying to go back to undo all of that instead. Like, oh, I wish I had known and I could have taken care of my health better. And
yeah, like in Ayurveda, there's a Sanskrit term which pretty much means threshold. You keep doing the things wrong until a threshold, like your digestive system takes it. But once you cross that threshold, that's when things start to blurt out, and then they are pretty much in your face. But the beauty of Ayurveda is that, PCOS can be reversed. I know in Western medicine, there is no full cure to PCOS, but in Ayurveda, PCOS is seen differently. It's not one disease, it's a combination of many things. And it's defined by your menstrual cycle. So if your menstrual cycle is okay, you are okay. And so there is a cure for PCOS in Ayurveda, which is the beauty.
Yeah, no, definitely. And I think, what you also mentioned was interesting about weight loss. Like, it's a common misconception, especially, I don't know, in Western medicine, if it's because of lack of research, but the understanding that if you lose weight, your PCOS will get better, or your symptoms will get better, or it will go away. But it's really like weight gain is a symptom of a hormone imbalance. It's not like, oh, because you gained weight, you have a hormone imbalance. It's actually the other way around. And I think that's hard for people to understand initially. And that's why practitioners always say, like, okay, lose weight and then your PCOS will get better. But really it's the other way around. Like, if you start balancing the hormones and, like you said, like you start getting your cycle back, then your weight will come off too.
Right. I think the mind plays a big role in Ayurveda too, which is, stress, emotional stress. It's because Ayurveda is always a balance of your mind, body, and soul, which they say very often. So to address all these three aspects, you have to, I think finding the root cause takes longer than the actual treatment in Ayurveda. They spend a lot of time in really knowing you as a person, your history, not just your medication history, but what is it that you are about? And that helps determine your body's constitution. Also, I want to mention that in Ayurveda, there's just not one type of PCOS. There's actually two types, because the balance happens, the imbalance can be between your Vata and your Pitta dosha, which is air and fire. The fire dosha plays a role in initiating or producing your hormones, and your then it could be Vata and Kapha, which is the mucus plus the air. So the way it represents, which you must have noticed in your clients, that some women end up not getting their periods, right? Amenorrhea, and then some women get very heavy periods. So that's the distinguish factor between what imbalance of which dosha is leading to how much period you're getting. And then the treatment also differs. It's not standard treatment for all women. So you really have to know where you stand to know your treatment.
No, that makes sense. And yeah, PCOS is very individualized. So like you said, a lot of different factors can impact someone. And so therefore the treatment is going to be different. So that definitely makes a lot of sense. Thank you for elaborating on that. It's very interesting, to learn about that. And it's good for people to know that there are other options other than Western medicine, other than birth control, metformin. And if people want to take it, that's totally fine. You can take it, but you can know that there's also other options, like, Chinese medicine, acupuncture, all of those are like different things. And then, we're looking at Ayurvedic medicine also. So that's really interesting to know. And for people to be aware that there's a lot of options.
Absolutely, especially women who are trying to conceive, who are struggling get a regular menstrual cycle. Because I've seen a lot of my clients who are basically women who are trying to conceive, and especially, women who recently migrated to the US. And I think the culture, the eating habits, the
Yeah.
air, environment changes, which also initiates PCOS in those women, especially. And then they go through the seasonal affective disorders and depression and anxiety
Yeah.
because they are pressurized in different ways. So
Yeah.
Ayurveda is
Right.
definitely, because it's not that you don't have side effects, but if you are taking it with caution, it's way better than taking um, allopathic medicine. I'm saying that being a pharmacist myself.
Yeah. I mean, I agree with you, and I'm a pharmacist too, working in a hospital right now in
Mhm.
Western medicine. But,
Mhm.
I think based on both of our experiences, unfortunately, Western medicine has let us down. And so that's why we're looking for alternatives and managing our own PCOS and helping others do the same. So,
Absolutely. Yeah.
okay, so let's talk a little bit about, so we know, you're passionate about Ayurvedic medicine. So how has that led you in your current career path?
Okay. So 2 years back, I was practicing in retail for the last 11 years.
Mm-hmm.
But 2 years back, I stopped retail, and I started my own consultancy with the goal of practicing preventative medicine.
Mm-hmm.
And so I'm the co-founder of Core Care RX, where we actually integrate value-based care, which is a type of preventative healthcare, along with nutrigenomics and Ayurveda. So we have patients through value-based care where we do
Mm-hmm.
chronic care management, and while running chronic care management, we identify, candidates, or actually patients who will most
Mm-hmm.
benefit from a certain tapered diet to their individual lifestyle or their genetic makeup, which is what nutrigenomics
Mm-hmm.
is. It's sort of like Ayurveda in the sense that in nutrigenomics, you tend to design diets based on your genetic makeup, like what will suit you, what will not suit you. And Ayurveda, of course, you design diets based on your body's constitution. For example, buckwheat is a very, it's a super grain
Mm-hmm.
nowadays, but buckwheat is not really for everybody. Like some people will digest buckwheat better than some other people. And the same with quinoa, or, the biggest one is rice. Rice has been criminalized in so many ways. And a lot of my
Yeah.
diabetic patients end up not eating any carbs because they think that eating carbs is going to
Yeah.
blow their sugar out of the
Mm-hmm.
face or something. And especially if they are of Asian descent and they are not eating their basic rice or their whole grain
Yeah.
chapati or their it's criminal, because then they'll feel hungry throughout, and that's going to also lead to insulin resistance. So that's where I sort of either take their genetic test, or I follow the Ayurvedic constitution and let them know how much of what they could actually eat and still be satiated and content. And the same with a lot of times, people are not aware of the benefits of basic herbs, or,
Mm.
mint or cilantro,
Right.
or rosemary, I guess, is a common one, but like the ginger root. They are diabetic and they are going through a lot of respiratory disorders, but they can't reach out to the doctor. They are struggling to reach out to the doctor.
Right.
But if you can tell people like that, hey, have a cup of fresh ginger tea and you'll be fine and you're going to get better in a few days.
Mm.
I think that's where I play a role in helping them with basics, a basic cultural eating of Ayurveda.
Okay, no, that's really interesting. So it's like basically looking at your genetic makeup and then personalizing it for yourself. So like the diet that you and I would eat is something different than like our neighbors or our friends, because we all have different genes, right?
Yeah. And patients love to communicate. Clients love to communicate what they enjoy eating, what they don't. And when you're doing chronic care management on them, you get to know them so well, and
Yeah.
you're talking to them monthly, so you kind of know what they like, their likes, their dislikes. And I'm so happy that my job is allowing me to communicate with these patients now,
Yeah, that's so nice.
which I kind of didn't get to do in retail as much.
Yeah, no, that's definitely good. So this can be used also, like you were mentioning, diabetic patients, but also similarly, like for PCOS, knowing like what types of foods that your body can tolerate. And I think, like you mentioned, you may try other diets, and you may get results initially, but it's hard to sustain those, right? And then,
I so agree with you because I've personally done that.
yeah, me too.
Yeah, that's just like short lasting. And when you gain back, the rebound happens with a vengeance.
Oh, yeah. Yep. It's always like more weight that
Yeah.
comes back. Yeah.
So it's all about balance. It's about eating true to your culture. That's a big point. You have to eat true to your culture because one of the famous nutritionists in India has says that you should be eating what you ate when you were in your mother's womb, and that's just stayed with me the whole time. Provided your mother, you know, eat awful, but
yeah.
but I know when I came to the US, I decided like I was going through the PCOS phase, and I was just eating like keto food, and I didn't even grow up eating meat. Like I grew up vegetarian, but when I came here and I found out that you could lose weight eating, just turkey or lean chicken, or whether it's organic or not, I started doing that, and it just wasn't suiting my body. Like I I would flare up with acne all the time, and eggs too. I didn't grow up eating eggs, but eggs are considered a haven over here, and I just started popping them in, and it just didn't work for me. So it's not for everyone, it's very individual.
Yeah, no, that's definitely a good point. And it's so interesting, like these new diets and fads that come out, that's basically what they are. They're a fad. Like people try it, it may work. I don't know. I feel like it's more like marketing, but going back to like realizing and understanding things you're saying, like, we all have different body types, and things that suit us may not suit other people. And, like we've been saying, PCOS is lifelong. So you definitely want to make dietary changes and lifestyle changes that you can keep up with for your whole life.
Absolutely, yeah. And even with the treatment, going to the Ayurvedic treatment, that's also very individualized. So, sometimes I get messages on Instagram saying, what shall I take? I have PCOS. No, I mean, I need to really know you. I need to know your history. I need to know your body constitution. I need to know what type of PCOS you have, which is what I spoke about, the differentiation. And then you can make the suggestions, even with the treatment. So there is no one magic pill in Ayurveda, unfortunately, even with where medicines are concerned.
No, definitely. Really, really interesting. Is there anything else you wanted to mention that we haven't covered at all with our whole conversation?
Sure. So, I mean, for women who'd be interested, and even young girls, unfortunately, young girls are, they are starting with PCOS as young as 15 or 16 now. I want to mention that in Ayurvedic treatment, the first thing before you take any medication, if you're buying something online or if you found something on the internet, just remember that before you take it, the first step is detox. You have to detox your body, either, doing purva karma, which is detoxing using clarified butter. Clarified butter is ghee, and ghee is like considered amrit in yoga, even though many people in Western science or even Indians will say that, oh, ghee is fattening and ghee is bad for you and it will raise your cholesterol. No, ghee actually cleanses your tissues, It lubricates your tissues, and especially for young girls, you know, with the amount of pressure and the growing stage that they are in, they
Yeah.
need tea for protection. And there are lots of other properties I can go on about, but keeping it short, you first start
Mhm.
with Purva Karma, and then if you are at a professional office, you could go with Panch Karma, where they do, you know, a lot of steps, nasal oiling, external oleation, internal
Mm.
oleation, Basti, which is like an enema. So there are different types of detox. You first detox your body, you clean your body, and then you take the rishtas, which are the syrups or the powders or whatever it is that, you know, you're trying to take to get your cycles into regularities, which is what we do, and which is why I advocate for detox so much, because detox serves as, you know, making your body into a clean slate where you can write
Right.
on it again, and it works.
Oh, that's really interesting. And you can help people with that too, if anyone was
Yeah,
to approach you.
absolutely. I help with
Okay, good, good.
maybe not the panchakarma, because the panchakarma you have to be in like a facility. Many do
Mm,
advocate panchakarma online, but not me. I
okay.
would encourage purva karma along with yoga, which is great for PCOS. And
Oh,
in the
yeah.
karma, we basically, I walk them through the oleation, how to take the clarified butter, and then, you know, the other steps about Ayurvedic nutritional counseling, and the dincharya, which is what you should do at what time. And I make it feasible with the lifestyle today.
Awesome. That's so good and really helpful to know. And yeah, I was like one of those people like, oh, I can't eat ghee because it's fattening. And then luckily I learned that that's not true. And now I eat ghee too. So yeah. Awesome. Well, this was really informative conversation. Thank you again for enlightening us on all of the Ayurvedic options that we have for managing PCOS. How can our viewers find you if they want to connect with you or reach out to you?
So you can, I'm on Instagram, as you know. My handle is Dr. Chinki Bhatia. And I'm also on LinkedIn, again, by the same name. And you can also look at the work we are doing by going to our website, which is corkerrx.com.
Awesome. And I will link all of that in the description box below. And if you guys have any questions, be sure to leave it in the comment section. If you're new here, make sure you subscribe to the channel. And if you learn something new, make sure you hit the like button and share it with a friend. As always, guys, be kind to yourself, be patient, and focus on progress, not perfection. We'll see you next time.
I love that. Progress, not perfect.
Yes.